Order the Boulder County Board of Health regular meeting, August 14th, 2023. It is 5:42. The first agenda item is public comments. And just before we invite our public commenters, I'm going to read a brief statement. The Board of Health provides the opportunity for the public to share their viewpoints and opinion on public health matters. It is not the practice of the Board of Health or agency staff, many of whom are top experts in their field, to review, vet for accuracy or grounding in scientific evidence, or provide responses to public comments at Board of Health meetings. Opinions expressed by the public should not necessarily be interpreted as accurate. The staff of the board does not challenge the perspective. And with that, we welcome our public comments. Thank you.
All right, the first one we have is Marty Hopper. So Marty, I'm going to make you a presenter, and your 3 minutes will start whenever you're ready.
Okay, can you see and hear me now?
Yes, we can. Good.
Okay, awesome. Hi everyone, I'm Marty Hopper, live in Boulder, and I'm speaking tonight to ask Boulder County Public Health to end its continuing promotion of COVID injections for all Boulder County citizens. The reason is that despite your claims on your website that COVID vaccines are safe, there is an explosion of data to support that they are not safe. For example, the massive number of deaths and injuries from the COVID shots reported to VAERS, as well as to the CDC's vSafe tracking system, which has 10 million users. Also, American insurance companies are reporting staggering increases in death rates not due to COVID. In some cases, up to 40% increase in deaths among working age population, usually our healthiest population, 18 to 64-year-olds, which is the exact group that was mandated to get the jobs to keep their, get the shots to keep their jobs. Of course, the CDC acknowledges the COVID vaccines may cause cardiovascular and clotting issues, among many others, but that may lead to injury and death, but states that such adverse events are rare. But this has me wondering, if such extreme adverse events are rare, I shouldn't personally know anyone who's been affected, yet I know an alarming number of people who are dying, quote, suddenly and unexpectedly. So if you just look at, and I've been collecting these Boulder County, Boulder Daily Camera obituaries. There was one just yesterday in Sunday's paper for Brian Beckard. Brian grew up in Boulder, and quote, these are quotes from the obituaries, passed away unexpectedly. He was a medical doctor and only 37 years old. A personal friend of our family's, Jesse Arito, who, quote, died suddenly of a heart attack in October 21. He was 48 years old and in top physical shape. He left behind his wife and 2 daughters, age 15 and 7. Another personally connection is Katie Flagel, whose obituary states that she, quote, died suddenly and unexpectedly in her sleep. I worked with Katie's mother for several years. Katie was 36 years old and left behind her husband, 3-year-old daughter, and 4-month-old son. I'm sorry. May I have a few more seconds to finish?
Sure. Yes, yes, you can.
Thank you. I didn't expect this. This is not normal. I've been around a long time and I have not seen this with our young people dying. And the thing that has changed in our world is that millions of people have gotten the COVID vaccines. And so I beg you to please stop promoting these shots. Thank you.
Marty.
Thank you.
Next, we have Carolyn. So Carolyn, I'm going to make you a presenter, and your 3 minutes will start whenever you're ready.
Hi, can you hear me?
Yes, we can.
Okay. My name is Carolyn Beninsky, and you have seen me a number of times here, and I want to ask you one more time why you're not allowing the public to come there in person. You are probably one of the last Board of Health in the country to be requiring us to be online. I want to just say that one of the things that has been seriously lacking during COVID is any kind of accountability or reevaluation of information as the shots have rolled out. It also applies to the lockdowns and to the masks. It seems like this Board of Health has just pursued policies that other boards of health abandoned after looking at the data. The problem with this is if you don't look at the data, the next virus will come along and you will be taking the exact same actions or worse than what you've taken this time. I mean, it's understandable the first time, but if you don't reevaluate and see the harms that were done by the policies, we will see that again. And I have sent you information from the Cleveland study regarding the vaccines, and also some information from the CDC about the myocarditis caused among young males who got the COVID shot. In June, I asked you several questions that were directed at you, the Board of Health, and also Lexi Nolan. You know, I haven't received any response. And that has happened over and over again. We get no response. The only way we can get any information other than what's on the website is to do a Quora request, and then we're told that costs hundreds and hundreds of dollars. But I will ask the questions again because I think you have an obligation to be answering some of these questions.
30 seconds.
Why are you promoting these shots given the fact that serious illness for children is almost zero from COVID and the risks are significant? Why are you still promoting these shots to low income and people of color? Do community partners provide information about adverse effects to the recipients? Why are you still pressuring Latinos and low income people to get the shots?
Thank you, Carolyn.
Thank you.
That concludes public comment.
Okay, thank you very much. Item 2 on the agenda is approval of the July 10th, 2023 regular meeting minutes.
I move to approve the regular meeting minutes from July 10th.
Motion and a second, all in favor?
Aye.
Any opposed?
Oh, okay.
Minutes are approved. Item 3, OWTSP discussion. Hi, Erin.
Hello. Thank you all so much for having us. It's been a while. My name's Erin Dodge. I am the Water Quality Program Coordinator in Environmental Health here at Boulder County Public Health. And we are here today. My colleague here is, you want to introduce yourself? I want to for you.
Hi, everybody. I'm Celeste Gleason. I'm the Water Quality Team Lead. I primarily supervise and oversee the day-to-day happenings for our on-site wastewater treatment system program.
So we are here today to chat a little bit about fees. And so I put together, felt like a ton of information, but probably didn't seem like enough to you all, just because I don't know that I've ever really presented to this board recently much about OWTS, or the septic, otherwise known as septic, on-site wastewater treatment system. So before we jump into the presentation and kind of getting into the nitty-gritty of the fees, I just wanted to see if there was any questions that came up for anybody with regards to something that would be pertinent to our discussion tonight.
I mean, I have questions about the fees that you're.
And that's exactly what I'm excited to
Don't
hear.
worry about it. Yeah.
Perfect, yes, and we're gonna have lots of time to do those. So I just wanted to make sure there wasn't like a question. So we did think we would start off with a little bit of like making sure we all know what a septic is and why it's important that we have some oversight over these in our community. So,
Yeah, I will go ahead and get started with that.
and then we'll jump into the fee discussion piece.
You just read it out with that.
Oh, yeah.
Yep, next time. Yep, you can just stay here for a while. All right. There is a diagram up there of a septic system. So I just wanted to give a brief septic 101 to everybody. I think most of us have heard, if not all of us have heard of septic systems. So in Boulder County, you will find septic systems in unincorporated Boulder County where there is no access to central sewer. Today, we refer to septic systems as on-site wastewater treatment systems, or OWTS for short. This change in names from septic to OWTS is because septic's really focused on disposing of the wastewater, where today we focus on treatment of the wastewater. So in 2013, CDPHE adopted the first comprehensive OWTS regulations, and they became a lot more complex and technical because, like I already mentioned, we're really focusing on treatment rather than disposal. A standard OWTS has a septic tank and a soil treatment area. The septic tank normally has 2 compartments, and that allows for settling of solids, and anaerobic digestion takes place there. From there, the liquid effluent goes out into the soil treatment area. As you can see in the diagram, once it goes out into the treatment area, the wastewater does flow down and it's treated in the soil. The soil works to remove pathogens, pollutants, and other nutrients such as nitrogen and phosphorus. And then from there, the effluent will go back into the groundwater. And then in the back of the diagram, you'll see a well. So the well pulls from groundwater and then essentially becomes your drinking water, which is why this program is really important in Boulder County. Boulder County has lots of areas with high groundwater. So we really focus on making sure we identify groundwater, that these systems aren't installed in groundwater or too close so that there's the proper treatment before hitting it. Anything that you wanted to add?
I think that was. Any questions?
Seen any unique characteristics this year with all the rain?
Definitely, again, it's sort of similar to, I would say, like post 2013, areas where we had never seen groundwater before. It was like the groundwater just was supercharged for several years. And I would say we're definitely seeing people arguing about, is it just water from the rain or is it actually groundwater? So, yeah.
What percentage of households have septic systems?
So it's only in the unincorporated areas, and I think.
Don't know about percentages, but we have close to 15,000 septic
15,000,
systems in Boulder County.
Thank you. And not all of those are on wells. Yeah.
Got it.
Yeah. All right. Well, no more questions there. We can kind of jump into the.
Sorry, one other question.
Yeah.
Are the rules different if you don't have a well on site?
No.
Okay.
No, because it would affect, the neighbors' wells, or it also can, at some point, the groundwater there's a nexus with surface water, and we have a lot of impaired waterways in Boulder County. So it's another hill that we're climbing in a different piece of our program, so. All right, I think we can move to the next slide. So we were asked to look at the fees. So we have construction permits primarily as the main revenue source for our program. Anytime somebody wants to alter, construct, or put in an entire new system, we give them a permit. And so it's been challenging over the years because of legislative issues to actually recoup our costs, because it was like a legislative movement had to be made. They had to change the statute. And so that happened, and we increased the fees significantly in 2020. And we were asked again to say, like, hey, what would it actually look like to completely fund your program with fees? And so lots of conversation there. I will say, I think that's a challenge for our program because not everything we do is related to the construction permit that we're charging fees for. So, enforcement. So when somebody's septic system is failing, doesn't seem like we should be using fee funding to go out and then enforce on people. That perhaps that's a separate pocket of money. Additionally, that our staff is not 100%. They're pretty close to 100% OWTS, but it probably isn't. It would be really problematic because then they would be funded by fees and it wouldn't make sense for them to be working on some other projects that are not necessarily related to issuing construction permits for septic systems. So when you're looking at our proposal, we did, we have 7 staff members actually working in our program, but you'll see that this proposal only has 5. And so that's because we've proposed with the new fee structure that we should at a minimum maintain 2 FTE. We currently have 4 county FTE that have historically been since my time, since Joe's time, allocated to the septic program, and it's probably because of many of the challenges that are going to come into the conversation tonight. So that's why there's a 5 and it's not a 7. So the total cost when we look at salary dollars is the $583,000 and change there. So that's like the staffing cost, and that includes benefits. So that's like a loaded cost for salaries and benefits. And then there's some operating dollars. Working with Catherine and her team, they said we're looking at a 10% indirect cost. So that helps to cover, we take a fee in, has to be processed, go into Oracle. Occasionally there's refunds, all the back and forths of money. And so we're looking at needing to recoup about $787,000. And so if any questions on sort of that walkthrough of like the number, like where the primary sources of the total fee or the total budget we're trying to recoup is coming from?
Can you explain the indirect cost one more time? I didn't follow that.
Sure. So typically when and I will look to Lexi and Joe to help me if I don't say this properly, but usually when monies are coming into the agency, we have indirect is taken out to help cover the administrative costs of doing business.
It's an allocation.
Yeah. It is typically 26-ish%.
21.
Thank you, sorry.
It's okay, it varies from year to year.
Yeah, can't keep up. And so they, it's kind of been 10% is where we landed for this process. And so that's what you'll see reflected in these numbers.
Was there an indirect before, Aaron?
There was.
Okay.
My understanding was it was the full indirect. And there's been some, just with the transition of staff and things, and there's been maybe some changes to that, but in my budget processes, it's always looked about that the full indirect.
I can speak to it a little bit about why we landed at 10% proposed going forward. So it previously, a number of years ago, it was at whatever the normal indirect rate was. And that money typically goes to, a huge team of admin and finance staff that are managing the money. In this case, we have some admin staff in environmental health that support the program, and it's not as much of a burden on the A&F staff. A couple of years ago, it was actually proposed to take it down to 1%, which we also didn't feel like made a lot of sense in terms of the actual workload. So what we're trying to do is to find the balance of what is the actual cost of the program, and we think that 10% is a little bit closer to that total.
Just an interesting note for discussion is that the state collects, we have to also charge $20 fee that the state collects. So I did not include that in this calculation. And then additionally, we always collect in $3. So we have like a $23 surcharge on all of our permit fees. And $3 stays with the agency for covering administrative costs. So I do think that going forward, working with Catherine to figure out, okay, we've got this $3 fee, do we keep charging it? And figuring that out will be something we'll come back when we are looking for approval to have all that stuff clarified with exactly where we'll land. Okay, next slide. Thank you. So this chart is kind of showing the primary categories of permit types that we look at. So the new permits, the major repair permits, and the minor repair permits are the three primary construction permits. We also have a property transfer program. Anytime a property sells, it has to get inspected for the septic. And then a use permit is really looking at, there's certain types of septic systems that require operation and maintenance. And so there's sort of these ongoing, some of them are renewable. Sometimes people are trying to put an ADU on to their property and like, we have to evaluate their septic. So we call them a change in use permit. So they're fairly new to our program. It's something we've started just working through in the last few years. So we're still gathering good data there to know what that looks like annually. So a little bit of some estimation in there. So we use those 5 primary fee activities that our program does and looked at like the number of hours it takes to do like one of the widgets or, one of the activities. And then sort of looked at the total number. So that first is the permit type. And then that's sort of an average 3-year rolling average of how many applications we receive annually for each of the different activity types. And so we used that and then the time that staff spend per that activity to sort of like average across the program, like what's the level of effort for us to do property transfer program? What's the level of effort around major repair permits? And so we use that to kind of forecast the new fees. And so the darker orange color is what's currently being charged and the sort of current estimated revenue of fees that we see. And then you'll see in the other column there, the proposed fee. So,
and just to be clear, we're not actually proposing any of these fees tonight. We're looking at an analysis of internalization of the costs.
Thank you. Yes, the potential fee, the full cost or the
cost recovery.
Cost recovery method of the fees. Yeah. So it's a pretty big jump from a property transfer that was $80 to $225. And in 2020, I think they were like 50. So, I mean, we're definitely looking at really big jumps.
And can I big jumps? Huge jumps. Can I go back to the imperative on this? So I'm reading the document to say that the Board of County Commissioners are suggesting that we might want to internalize these costs, but it is not required necessarily. Like, how are we?
But they also did not want to cover the increased costs when we asked them about that, right? I mean, that came up in our joint meeting with them about the budget.
So they can't really require us to do anything, but they can make decisions about how much funding that we get.
Mm-hmm.
So how do you want to interpret that? They are interested in all of the departments looking at, what is actually the rational way to structure some of the work that we do in terms of what should be a county, a use of public funds as opposed to a financial burden on individual members in the community that use those services or that are benefiting from those services. And this was one of those spaces where they felt strongly that the cost of the program should really be borne by individuals that use the program. I will say that they were open to thinking about creating an equity fund that would support lower income members of the community to be able to offset some of the costs for them. That is one of the things that we would be exploring going forward in terms of coming back with a proposal. But no guarantees in that space. They would want to run it, which I'm okay with, sure. And it would replace what we have now is a sliding scale, but it's set at such low incomes that people rarely have an opportunity to actually use it.
I think that's helpful.
And that equity fund would just be for OWTS?
Yeah.
Is there some regular interval that you also have to go out and inspect these?
So there's a lot of inspection taking place during the construction. And then once it's buried, We typically do not inspect them unless somebody either complains about a neighbor or calls us and says like, hey, we think our system is failing. We may go out and do an inspection. Otherwise, it's at time of sale of a property. It's required to be inspected. But yeah, we have systems that are from, I mean, the oldest permit we have found is like 1951. And some of those those have never even been looked at since they were put in.
Really?
So, and then that's a whole nother presentation I would love to come back and give you.
Also some higher level treatment systems that have advanced treatment units, and those are kind of fall under the use permit ones. So those are required by regulation to be inspected annually to make sure that they're still functioning properly.
And then, sorry.
Oh, sorry, because they're dealing with more units or.
Yeah, well, so they get like a reduction. So it's usually the treatment happens in the tank. And so it's like a higher level little wastewater treatment plant like that city of Boulder has. It's like a little mini one of those. It's got like bacteria that's attached and helps spur along the nitrogen cycle is primarily one of the larger things that happens there. And then you can like have a shallower system. You can get closer to like a limiting layer, like groundwater. So you don't have to have as much treatment once it leaves the tank. So that's why we want to make sure that that is always working, because it might only be 2 feet to groundwater versus the required 4 or 3 feet, depending on.
Like 75 feet to the well instead of 100 feet that it's normally required to be.
I'm just curious, having lived a lot of my life with septic systems, just not here. A major repair on a septic system can be a huge financial burden.
Yes.
Plus now you're going to add $1,500 more onto the already pretty high fee for it. I would be curious then how much you'd actually make if you're then going to set up an equity fund to offset this for lower income people.
Well, the equity fund wouldn't draw down the fees, it would be paid by the county.
That's what I mean, but if the whole idea is to save the county money by individuals, I just think of, a lot of people that are living in unincorporated Boulder County, and this can be a financial devastation at this point. So, I just wonder, is it even worth considering if 60% of the people that would potentially fall into this would be covered by the county anyway?
But I wonder, Brooke, that seems like a high estimate, right? I mean,
I'm
about
just
how many,
exaggerating.
right, no, but I do wonder how many people would fall under that income.
Exactly.
And what they would
we don't
set it
have
at.
any details
Right.
about what they're.
It's also just an interesting policy question because like, for instance, I've been learning a little bit more about gray water systems, and that's coming potentially right down the road, as you guys well know better than I do. And you start to think about like gray water systems are wonderful for saving water, right? And conserving water, but it costs money. And one of the inhibitive things in this is the cost to the counties that want to implement these things, but they don't have the staff to regulate them. And so it's just there's an interesting balance here, right? I think in terms of what people want in terms of innovations and systems that support their individual house, but then what do we sort of take the burden collectively as a community around? And so anyway, I think it's fascinating.
Yeah, I just wonder if perhaps it should be offset more by new permits than by major repair.
Yeah,
permits.
so in those 12 hours, I assume that involves having to go out to the site and see it.
And that's also an idea that we have thought of is really wanting to offset it with the new permits instead of major
I would
repairs.
think new permits and property transfers are a better place to offset these costs. Because then you're coming into it knowing this is what you're going to pay, as opposed to now doubling a major repair permit.
And maybe that's where the equity fund really plays more of a role if there's like finite resources,
You don't need
right?
as much when you're looking
Right.
at new permits and property transfers.
Yeah, so to be clear, a new permit is really only issued when the lot has never been developed ever.
Exactly. So
It's,
it's a
if it's been
privilege to-
it's a privilege to get to build on a brand new lot in Boulder County.
Would you know, Aaron, like,
or buy.
in essence, what is a new system in an old property?
It could be like 30,000, and it actually can even be more difficult for a repair because the regulations have required the systems to be bigger and a little bit more complicated. And so things that got like squished into a Pine Brook Hills lot that's on a steep slope with tight lots, you know, and it's, you know, we just recently were telling someone like, you probably cannot actually have that third bedroom that you want because your property can't support this septic system. And so I think that in times like where people want to add bedrooms or put an addition on their house or build a pool house, guest house, those are the times when it feels like equity, using that equity lens, like, okay, we're, you know, commercial, looking at like non-residential systems, like we definitely, those are much more complicated. We spend a lot of time on those, which is probably why you see the hours per permit for the new permits and the major repairs. They used to be really close, but I think like new permits can just be really complicated too.
I have a question. I know it's averaged over 3 years, but what's the trend line? Like, are there many?
Yeah.
I mean, we're running out of land to some extent,
Right.
right? Like,
And a septic system only lasts for, you know, average life expectancy is like 15 to 30 years. So when we see these ones from the 70s, we're like, oh, you're buying this house, you're gonna remodel it, you should just replace your septic. Like, I don't want this to fail and then back up in your nice, beautiful, like redone house.
I think some of the
So-
challenges too are that the homes that are left that have an approved septic system, we're trying to remodel now, are pretty difficult sites, so it's costing a lot more. And frankly, sometimes it can't be engineered. Like you said, they may not be able to add a bedroom.
Yeah.
is there a way for them to tie in or no?
No, so like up in like Ward.
Oh, okay.
Right, depends on where you
Yeah.
are, I
Okay,
guess.
Yeah.
So, and some.
Exactly. So the mountain communities, the plains, there's like, I mean, even then, like there's a subdivision that's gonna go in on Niwot and 63rd. And they're pretty close, but they probably are looking at putting septic in there because it would be really disruptive and really cost prohibitive for them to run sewer line all the way down 63rd to somewhere, probably the water treatment plant, I'm pretty sure.
We're already, I mean, I kind of remember this, we're already one of the highest counties in the state in terms of.
Yeah, there's a few that are, we're neck and neck, yeah.
Right, so, and is that, and again, I think we talked about this in our joint meeting with commissioners, but that is, a lot of other counties are subsidizing. Oh, and also our cost of personnel is higher here, is that the combo of?
Yeah.
There's been a real debate, as long as I've been in public health, working with environmental directors, really what should be the public bear in these kind of costs versus industry, especially when it's for profit. You see it in the food safety, when we look at food fees, you know, there is a public health benefit to that, to the general population. So should they be covering some of that? And some of us think it should be covering more than others. Personally, I probably fall more on getting cost recovery when it's for profit industry. And I do think having that sliding scale or some equity fund would be really helpful for the repairs. And then I also think there'd be an opportunity to use that for people that are applying for building permits. I don't think they just do it for OWTS.
Right, yeah.
Because those get to be expensive too,
Totally.
especially your existing homes.
You know, one of the challenges I see with trying to sell whatever proposal comes down the line is when you look at the staff time estimate, it's already over $100 an hour, which, you know, for most of us would be like, you know, if we're hiring a contractor, right, it'd be like, well, that seems pretty high. But I mean, and then on some of those, it could go to close to $200 an hour, which is, I don't know. I mean, for a review, it's just it's tricky when it comes time to sell that.
Yeah. A few things just to keep in mind too is in 2019, we switched to our new database. And it significantly improved our ability to capture our time. So the data that's coming out over the last few years, of course, COVID happened in there. And so some of our processes got a little bit of a lag in getting things to where we want them to be. But we have a dedicated staff member just to respond to phone calls and emails every day of the week. Because the traffic is that high, it was bogging everybody down so that we had to funnel it so that everything that's generic enough can just be managed. People calling, I'm thinking about buying this property. What do you know about the septic? And so decisions like that we have conversations about well, how far do we help this person? Customer service and wanting to do the best and provide information, but balancing it with workload. So things like that are really hard to capture. But I do think go back into like a cost of a property transfer. That's probably our highest intensity program in terms of like, so like the realtors calling, and then you've got the hot market ticket.
The buyer, the
Yeah.
seller.
Yeah, I think you could definitely charge more there,
I think
especially
so.
these systems from the 70s.
Yeah.
Yeah,
Probably.
I just want to clarify that the purpose of calculating the staff time per permit was to create a proportionality, but that's not all of the work that goes into
Yeah.
doing
And I think the other thing,
processing permits.
as you see, there's a 3-year rolling average, is like you were asking about trends, and it's pretty consistent. Right now, we've had lows during recessions, and then we've had years where all of a sudden, we don't know what's happening out there, and we're like getting 300 applications, which is like, 40, that's like almost an entire FTE's worth of work. So those sorts of things it's a very difficult, like our food team, they're like, okay, we have, 1,500 facilities divided by 8 employees. Everybody's going to inspect this many restaurants. And you can kind of like plan your year. Our team, it's like, well, who knows what's coming in today? And so it's very hard to plan this workload. And it's also extremely lengthy time to train. So ramping up and ramping down and saying like, oh, we'll just if we get slow, we'll just give somebody to the food team. It's really difficult because it takes probably a solid year to train somebody who has like really very limited experience coming in. So I think in my head, the story I tell myself, the reason this program probably had county funding early in the days potentially was because it's a service that needs to be done. And we can't always rely on fees. So I think that's something to consider in your thoughts between now and a potential proposal is what would we do on those years where things slow down? How do we cover those costs? Because
when things are slow, you still have to pay people.
Sure.
When things are busy, you have to hire more people.
Right.
So it's not like you can use an average.
Yeah.
Well, that's what I was just wondering, like, are we picking up or are things winding down?
We do also have about 800 unapproved OWTS in the county.
Oh, unapproved?
Unapproved, yes. So,
Meaning they've never requested a permit.
yeah.
They have a system.
Wait, people have just built them? Wait, what?
Yes. So they put it in without, they didn't contact
Unapproved,
us.
unpermitted
Where
is,
does ours go?
But they could have been put in the 50s when there wasn't.
Yeah.
a permit.
yes, when there
Okay.
wasn't.
But I do think that your point, when we've had this conversation about the increased fees is, do these higher fees then encourage moonlighting?
Right.
I'm not gonna pay that permit fee, I'm not gonna pay
That goes
$50,000 to put in this expensive septic that needs regulation. I'm just gonna put my 55-gallon drum back in the ground and that's gonna settle my wastewater. I mean, that's what they used to do, so.
I mean, that then lends itself to, and I would support what Brooke said earlier about increasing, like weighing more heavily on property transfers, because then it all has to sort of be above board, otherwise, I get in trouble doing that. And then the new permitting, is if you're building new.
And that fee can get
Right.
rolled in to a lot of things for people with that transfer.
Yeah, but there are a lot of a major repair, if you're looking at a $30,000 septic repair, 2,800 is not gonna make or break you, but I mean, the new septic is what's gonna make or break you.
Dig it up and piece it together.
Yeah.
Happen.
Yeah. Right, but I mean, but the cost prohibitive part of that is the new septic. It's not necessarily the fee.
I think part of the problem too is that we don't review fees systematically enough and consistently
Right.
enough to be able to keep up with the cost of, mostly salaries. And these fees haven't been reviewed in a few years. I know that Joe was saying that when they were talking about the time per permit, that actually our team is pretty efficient. I think we'll continue to look for efficiencies and see, where to go with the scale.
Is there any opportunity to like recoup a fine or something on these ones that are
That's
not?
another one of those efficiencies. So in addition to like the things that are not necessarily tracked as clearly as I would love to see them tracked by our team in terms of tracking time, There's also things that, and it just left my brain, what was?
More of the stick approach to find the people.
The things that we don't do.
Or our $50 per
Yeah.
day per violation.
Yeah.
Yes, we do have, so there's some things that we just don't have capacity to get to. And so Celeste was mentioning the undocumented systems, and that was a large campaign that was kicked off in 2008, the Septic Smart campaign. And it was really to address those and try to get them to, made huge progress. We're like 75% of the way. We had like 4,000, I think, when we started. So like some of it was like documents, like not being, you know, like old permits needing to be linked to houses, data cleanup, things like that. But we do have things that we do that certain triggers, like property transfer is a great way to get people to put in a new system. Oh, sorry, that's undocumented. You're gonna have to replace that system. And so that is, I think that also another thing is like looking at the fines that we use and like when do we actually start charging fees for things, like it's something that we just have not had the capacity to really build out like a clear program, because you want to make sure you're like everything's lined out properly.
You need like a 1-year announcement of like, we're gonna start to
Right.
do this. Here's your opportunity to come.
Exactly.
It's really hard to, like, we do have the fines in our regs. It's like $50 per day per violation, but people are already struggling to install a $30,000 system. So then to tack fines on top of that, I think it's something we could definitely do if we were just getting complete non-compliance. But I think that's where we struggle too with fines.
It's really those building permits when they're adding to the home.
Yeah.
Or time of sale when money's changing hands already.
Those are good.
Right.
Yeah. The review.
Joe, are we testing groundwater regularly? That was another, like, no, okay. Interesting.
I mean, there's some research that we do with, as far as stormwater and
Yeah.
some of the creeks for
Yeah, okay.
impaired waters, but no, not.
Okay, we have like anecdotal data sets from like people supporting people with well testing, and they share their well data.
Yeah.
Surprisingly, we're doing some, love to come back and share all these things that we're doing, but we were just looking at some groundwater modeling data that we're trying to pull together. Some models for building some GIS maps, and like, you look at the maps out there and there's just like, Boulder County is just this blank void of any sort of groundwater data. And like all around us, it's getting measured. And so we're like, what is going on? It's like there's like a boycott on any sort of groundwater measuring in Boulder County. So I think a lot of it is that we're mostly source water. For drinking water, it's mostly supplied by source water, but that's a different presentation. Sorry.
Yeah, so interesting.
Yeah. Groundwater, there's really, Boulder County as an entity does no water quality monitoring. I will say Parks and Open Space does some, and maybe there's some like anecdotal, like one-off studies, but we do not have a water quality monitoring program in unincorporated, the Boulder County.
And there are no
In
regulations.
unincorporated, so in the city.
In the city, that's different.
Yeah.
But then you're on sewer anyway.
Yeah, you're on sewer.
So there's really no regulations governing drinking water for private homes. And we've done some PFAS testing.
Right.
You know, there's, radioactive materials in the mountains that show up now and then. We know there's heavy metals, so that's where we just continually recommend people test their water once a year and put on the systems to treat it if they need to.
My thought is probably the people with drinking water wells don't voluntarily test at a more than maybe less than 10%.
And they don't want to voluntarily share that information if it affects the cost of their home.
Right, exactly. You can't sell it.
Yeah. Property values, yeah.
I mean, so just getting back to the fee increases, and I think, I think we were on the board the last time we increased the fees. There were a couple of people that, like contractors that do septic that came in. And
Yes. What a great transition.
Gave some feedback.
Yep.
I mean, they ultimately pass that on to whoever they're doing the work for, but I don't know if you've had the opportunity to, or I guess when you get closer to maybe these are what we're recommending. Oh, great.
That was like,
Perfect.
news coming soon. There we go. Yes. So just kind of going forward, I think in the short term, as I mentioned, we want to refine the fees. There's like some additional costs and some like really small, low number of permits. Like we have like a less expensive minor repair for small repairs, and some like additional inspection fees that we charge that is not represented in the data that I showed you tonight. So working with admin to sort of fine tune some of these numbers a little bit, and I think applying some of the feedback and things that you shared, like the equity sort of approach to charging fees in certain places, maybe more money. And then definitely would like to bring this to our professional group and kind of say, where would this land? What do you think? Like getting some feedback from them, because I do think they're the boots on the ground. They're the people working with the clients that they know if they're going to be like, you're already, probably struggling to get everything you need out of these things. And so that will be good. And then again, just answering questions that you all may have had. And then coming back maybe in early fall with an update and perhaps an actual proposal at some point once those things are done. And then like in the long term, just really continuing to improve our data and, refine the data that helps us sort of assess time per permit. And then always continuing to try and create some efficiencies in our program and seeing where we can, do better. I also think there's opportunities within our program to have like a whole commercial permit fee and, charging for those outside of that. And like they should be on a renewable permit because tenants turn over and sometimes we don't hear about that. And it's really important that if it was a small realtor office and now it's a hair salon, that's a significantly different amount of water generation. So needing to make sure those are tracked better.
Is it legal based on the cost of the property to charge different fees?
So the way community planning and permitting does their fees is it's a valuation.
Mm-hmm.
So they're like, okay, you're re-roof or you're doing a small little, thing, tough shed on your property.
Mm-hmm.
It's a very low permit fee. You're building a huge guest house. It's, I don't remember what the percentage is, but it's a pretty hefty. I mean, their permits are like $20,000, $30,000.
Yeah.
If you're building like a huge addition or a second new house or something, it's.
I'm just wondering, like if you're buying a $10 million property and putting in a pool house, like charging them $5,000 is not going to be.
Yeah.
They're not gonna bat an eyelash, but if
Right.
it's somebody with a septic from the 50s that inherited this
Right.
ranch from,
Yeah.
it's just a different situation
Yeah.
altogether.
It's interesting, we do get complaints about the cost of septic, even for those.
They can complain all they want, but they can still do it.
The other question I had, and I'm glad you are talking about Marshall, is because disaster recovery is also another issue, right? When someone's facing, like after the Marshall fire, after the floods, when people have to replace their septic, and that just adds to.
Yeah. We're still doing flood permits.
Yeah, right.
So that was 2013.
4
Right.
Mile, I think, too.
In
I
4
think we
Mile fire.
had 4 Mile the other day.
Yeah.
So I will say Marshall Fire has been extremely different. Like the permit workload right out of the gate was really high. I was like, oh, it's usually trickles in over a couple the first year, a little more the second. Like, no, it was like within 6 months we started getting those. And then the ADU allowance has really significantly complicated. People just do not understand that a second dwelling is not just another bedroom.
Right.
So it's been a lot of education and and so of course the people are also traumatized.
Right.
They're not necessarily
That's probably
hearing.
something that we need to think preemptively about is, there's an awful lot of conversations right now about changing housing regulations and understanding how those would affect our program would be important.
Yes, we deal a lot. We work very closely with community planning and permitting, and they have the short-term rental for like VRBO type. And those are very difficult with septic. And so we review all of those. We actually review just about every land use process there is and comment from mostly water quality, but trying to be a little bit more holistic and grow that side of things too, to be more public health centric. But for sure, the septic piece
Well, we're clearly very interested in the topic, so thank you for coming and sharing this with us. And we, I guess if there are any other follow-up thoughts people have, we'll send them your way. But
Yeah.
you giving us the preview, and we look forward to, I guess, hearing follow-up.
Thank you so much.
Thank you. Okay, item 4, Greg Thomas farewell. I know you don't have the agenda in front of you, so it's a surprise. Great, thank you, Jordan. So, this is Greg's last meeting. Greg has been on the board for 11 years, 11 and a half.
Yep.
And we're gonna miss you. So we're gonna, I'm gonna read a letter here, and then I think we can add a few personal comments too. So dear Greg Thomas, on behalf of everyone at Boulder County and the Boulder County Board of Health, we want to thank and acknowledge you for your 11 and a half years of outstanding service to our community as a member of the Boulder County Board of Health. Your strong and continued dedication to the health of Boulder County community members is greatly appreciated, and you will be missed. You provided us with great leadership, guidance, expertise, and heart in helping to shape our agency as well as public health in Boulder County and Colorado. Your services as a board member, including 1 year as vice president and 8 years as president, I don't think I realized that before, as well as your commitment and support of our staff, our organization, and the community truly exemplify the best in public service. The unwavering leadership you provided during multiple emergencies, including the 2013 flood, NCAR, and Marshall fires, and addressing unprecedented public health orders and guidance during the COVID-19 pandemic were outstanding and shaped the future of the Board of Health and Boulder County Public Health. As you close this chapter of your service, I'm going to say service, we would like to honor and thank you for your contribution by providing you with a small token of our appreciation. That's here. We promise to continue advocating for the protection and improvement of public health, especially doing all we can to champion health across the county and state. Thank you again, Greg, for your excellent service to the residents of Boulder County, your colleagues on the Board of Health, and to Boulder County Public Health. We wish you much happiness and success.
This is I've kind of anticipated this day coming, right? And, I've been looking back through, believe it or not, I've kept all my Boulder County Board of Health emails back to March 9th of 2012 was when I got my first email announcing that I was going to be one of the board members. So, it's just been a really interesting run. Obviously pre-COVID, things were fairly predictable, but still the floods, I forgot all about the floods, and all the work that the county did, not just public health. And to think and to see where we are today, all the way upstream, downstream, it's, I've been proud to be a small part of that team. And so, I look back and I said, geez, who were the commissioners who nominated me? And it was Deb Gardner and Cindy Domenico and Will Tour. And some of those folks are still around doing really important work. And, I thank them for having faith in this environmental health guy. I got to admit, when I think back to when I first started, I felt like, man, I feel like a case of imposter syndrome here. Because, you guys were you are an integrated health department. And where I came from, we were 2 health departments at the time. And I was an environmental guy. So I thought, well, what do I know about mental health and behavioral health? I know a little bit about environmental health, but, but kudos to all the staff, the leadership. You guys brought me along. You educated the hell out of me. And that actually benefited me in my career because, when we finally went through the motions to become an integrated health department, I had a lot of lessons that I learned here that I could apply. So, a big thank you to all the staff for the really interesting presentations throughout the years, OWTFs. Thankfully in Denver, we have almost none. But I hear a lot from my counterparts throughout the state, including Boulder, and that's a significant program for a lot of folks, a lot of LPHAs. You know, and just, you know, the whole variety of things, right? I mean, the double up snap bucks, I thought, yeah, that's a really cool concept, and it grew, right? And the mobile homework. I mean, I was thinking, well, who's gonna, you know, how are they gonna find that political voice, especially at the state level, to really kind of take this beyond just a county level program? And, you know, so it's just been, I've been so impressed with the work, and I've learned a lot. And I just wanted to say thank you to everybody who contributed to my knowledge base along the way. I did utilize it in many ways, whether you know it or not. So it's been a great run. The good news is, with the conversations today about budget, not so great right now, right? It's just early, we don't know, it's uncertain. But you've got the best board members that I've worked with in 11 years. And they care about staff, they care about leadership. And having been through some of the challenges of the last couple of years, you guys, public health is, you know, while there is a lot of effort to really kind of, you know, recognize and retain and build that public health workforce, figuring out how to pay for it, yeah, that's a challenge. But it's going to happen, right? And so even if budgets are tight for a while, there's serious effort underway to really figure out, how do we fix this funding formula, right, for public health? Because there will be another pandemic, and it may not be to the same degree, and there will be other environmental catastrophes that your services are going to be needed on. So support each other. I know it's a struggle when you're thinking about, well, my program might get cut and so, and like, forget all that stuff, man. You guys are a small and mighty team. You are respected in the state. You are respected throughout the country. Support each other, including your leadership, and leadership will support you. And in the end, the Board of Health is going to be the ones to really ensure that that happens both ways. So good luck, everybody. I will maybe try to jump on the comments, or maybe I'll even come see you in person.
Please do.
Maybe I'll come see you in person whenever it opens up again. It's been a great run, and God bless you. And this is really cool.
That's really cool.
Yes, oh, that's awesome. That's really cool.
Yeah, this is very cool. So that's really what I wanted, is want something I can take out of my office and look at every day and say,
I actually remember the dates. Yeah.
all right.
Thank you.
Well, I really do appreciate it. Thank you.
We're gonna really miss you, Greg, and your historic knowledge and your experience in Denver, and I'm gonna especially miss just your steady voice throughout all the ups and downs that come our way, and really appreciate your leadership.
All right. Well, I appreciate that, Morgan. And, you know, every successive president puts their own stamp on things and tries to guide. And that's where I walk away feeling really good with the direction of this board.
Greg, I'll just say, when I joined, which feels like it was like just yesterday, but it's not anymore. I, like you, I felt like a complete imposter. I still feel that way to a large degree. And I remember walking out of my first board meeting and thinking, I said to my husband, that is the most incredible group of people that I've ever heard interacting with each other. And I've been in a lot of rooms in my career. And I just remember you and your voice, your calm, steady voice. And I came in the middle of a catastrophe, literally, and the whole team's ability to help each other and support each other through those conversations was unbelievable. So thank you for your leadership, truly. It's been a joy to watch.
Yeah.
Yeah, I'm glad I got
do
to
my
work with
best.
you before the pandemic. I'm really glad you were in charge for all that.
Greg's just unflappable.
I know.
And everybody else would get a little stressed. Very calm,
So that will be very much missed.
Yeah,
For
great.
sure.
We're gonna all be channeling Greg when we get to these hard meetings.
All right. Well, again, very proud of the work that I got to do with all of you.
I know I speak for staff when I say that they always felt your support and appreciated it, particularly during the pandemic, which is my experience with you. We didn't always know what the right answer was. And figuring it out together was really important and appreciated. Thank you.
You're welcome. And, I'm not like leaving the profession or anything. I still got 6 years to go, so hopefully I'll bump into several of you at various environmental meetings over the years, and and I'll pop in every now and then to say hi.
Please do. And we welcome you for public comment. We really do. Good. Well, it's a tough transition back to the business of the meeting, but I think we just have a couple other things and then we'll go out and celebrate Craig. Item 5, director's report.
Thank you. I just have a couple of things I'd like to lift up. You can flip to the next slide. The first one is you will have read in the director's report that we were starting to see the impact of West Nile on human cases. In particular, I did want to share with you some data that Joe sent today. That last week 32 is from last week. We are starting to see some drops. We're not out of the woods, but it's a significant decline from the last few weeks. We know that hospitalizations lag a bit, but this is definitely showing indications of, at least for now, going in the right direction, and we'll keep an eye on it and keep you updated in this space. And we have been working with Longmont and other municipalities to talk about extra spraying. We've done some extra spraying ourselves.
I've heard the spray trucks through Longmont a couple times over the last month. And unfortunately, one of my neighbors was, I don't know if she's, or she is in the official stats yet, but they have West Nile. I think they got it in the neighborhood. So I'm like, okay, well, guess those spray trucks are warranted.
Yeah. Okay, and the other thing that I wanted to just draw your attention to was to celebrate our Pinnacle Award winners a little bit. As you may notice, an annual award presented by the Boulder County Commissioners, and they have one recipient per county value, and our county values are inclusion, stewardship, engagement, innovation, sustainability, service, and resilience. And this year, our, go ahead and jump forward, our A La Raiz, to the root program won the award for, I believe it was engagement.
Engagement, yeah.
Yeah. And this is the team at the awards ceremony. This program was really a very in-depth outreach to over 100 youth in the county to talk about their perspectives on mental and behavioral health. And the team did a great job of really collecting the data, feeding it back to our partners that were working with us in this space, and feeding that work directly into the mental and behavioral health roadmap that we've been working on with other county partners and community partners. So congratulations to that team. Next, the immunization program won the award for service, and this is an initiative that is particularly valued by the county commissioners, who believe strongly in the importance of immunizations. They did something like 7,600 vaccines in 2022. We're so good at creating welcoming clinics for folks that community partners would ask them to come and be with them to deliver vaccines, and that they would choose Boulder County Public Health above other groups that were providing vaccines. And just for the icing on the cake, we just received information about our vaccine numbers in the schools, and they were exceptional.
Yeah, they're great.
Yeah, over 90%. And sometimes 95%, 96%, up to 99% in some categories. So that was really heartening to see. Congratulations to that team. And finally, our bilingual infant and early childhood mental health consultation program received the award for resilience. This is a program that really focuses on working with our nurse home visitation programs, including Family Connects, Nurse Family Partnership, and works with parents to help them to do screenings for both parental and young child needs, referrals, a lot of training of parents on how to provide mental and behavioral health supports to their children and development supports. This team also won the Commissioner's Award, Commissioner's Choice Award. So it was the Commissioner's favorite program this year. And I just want to say that, we have a lot of amazing programs in Boulder County Public Health, and we're really proud that we were able to represent so well at the Pinnacle Awards. One more forward. And just want to take a minute to acknowledge some of the other great programs that won awards, including out of HHS, out of Oscar, out of the DA's office, really strong programs in other categories too. And we appreciate the commissioners continuing to make these awards and recognize the great work that staff do across the county. All right.
Bravo, okay.
Awesome.
Item 6, old and new business.
We have 5 applications for an export.
Oh, really?
Oh, yeah.
Fantastic.
Good. Thanks for that update.
Awesome.
Did it close?
It closed, yeah.
That's fantastic. Thank you for sharing that. Okay, thank you for that. And item 7 is adjournment. Here we go.
Well done, Morgan.
Thank you.